Hi, everyone. My name is Sarah from Duke University, and it's a pleasure to present my work, Rhythm of Recovery, Patient-Centered Virtual Reality Exergame for Physical Rehabilitation in the Intensive Care Unit. Clinicians face significant challenges in practicing rehabilitation in the ICU due to so-called ICU-acquired weakness, which has multiple factors playing a role, such as patients' life-threatening condition, their limited mobility and prolonged bed rest at the hospital, and also the presence of many medical devices in the ICU room. While the clinicians implement early mobilization protocol, which involves a huge team of nurses, therapists, and doctors, this is very challenging due to patients' dependence on monitoring devices and IV lines, their restricted mobility due to critical illness, and difficulty in safely moving patients out of the bed. Moreover, quantitative assessment of motor progress is rarely feasible in the ICU, with most evaluations relying on subjective or self-reported data. To address these challenges, we present a patient-centered VR Exergame using MetaQuest 3, designed to support upper body motor recovery in ICU patients, developed in interdisciplinary collaboration with clinicians and therapists. We evaluated the system in two stages. First, a dual user study involving healthy participants and healthcare professionals or students to validate design feasibility and iteratively refine the Exergame based on user feedback. And second, a clinical study with cardiothoracic ICU patients at Duke University Hospital to evaluate system feasibility, acceptance, and integration into ICU care workflows. The main objective of our Exergame for the patients is to catch the music lines flying towards them by using their hands in the VR environment. We selected a calming beach environment for the Exergame that incorporates dynamic environmental elements to enhance immersion and engagement. We designed the guide character Lumi to be friendly, cheerful, and optimistic, incorporating expressive facial animations, natural gestures, and calm vocal tones to foster a sense of comfort and companionship. During gameplay, Lumi provides step-by-step instructions for each rehabilitation task, offers encouraging feedback when patients reach performance milestones, and celebrates their success at the end of each level through distinct animations and positive reinforcement. Due to varying degrees of mobility limitations among ICU patients, we designed and implemented 4 progressive levels of mobility challenges in collaboration with an expert physical therapist. Each game level was developed to gradually increase both range of motion and exertional demand. Starting from wrist and lateral movement of each hand in level 1, the mobility challenges enhanced to bilateral and overhead movements of both upper arms as the patients progress to level 4. As the level increases, the music rhythm and movement duration increases to make the user experience more engaging and corresponding to the increase in movement demands. To evaluate the effectiveness of our VR Exergame in supporting upper body motor recovery, we conducted 2 user studies. The first study was implemented in a nursing simulation laboratory with healthy volunteers and recruited healthcare professionals or students. The second study was carried out in a hospital setting with cardiothoracic ICU patients, supported by a clinical team of 7 nurses trained in VR applications. We evaluated the quality of the overall Exergame experience and engagement in mobility challenges through various questionnaires, while measuring physiological responses and post data from 70 upper body joints from MetaQuest 3 headset for quantitative assessment of patients' movement progress. For user study 1, we recruited 13 healthy participants without upper body mobility impairments for the patient role, and 13 healthcare professionals and students for the clinician role. For user study 2, we recruited 18 cardiothoracic ICU patients from Duke University Hospital, where their mean duration of ICU stay at the time of participation was 8.4 days. Surgical procedures among participants included heart transplantation, coronary artery bypass grafting, aortic surgery, and mitral valve replacement. To ensure patient safety and maintain procedural consistency, a dedicated ICU care team of 7 experienced nurses oversaw all sessions and provided a survey-based feedback after the study. We present the major parts of the results from the study with the ICU patients, demonstrating that our VR Exergame provided a positive user experience while imposing scalable exertional demand. The Game Experience Questionnaire, GQ, shows that high scores were reported for categories that indicate positive experiences of the patients. Furthermore, we observed statistical significance in physiological changes, including heart rate and blood pressure, showing that there was an exertional demand for ICU patients, even with limited mobility. From the post data collected on the VR headset, we computed 3 movement metrics: speed of motion, range of motion, and workspace of motion for each hand, elbow, and shoulder joints of patients. Statistical analysis tests with one-way repeated measures ANOVA indicate significance across all levels, demonstrating that there was a progressive movement for all upper body joints of patients as the level goes up from level 1 to level 4. ICU patients demonstrated the same systematic increase in speed, range of motion, and workspace of motion as healthy participants in user study 1. However, their absolute performance remained substantially lower, reflecting their physical limitations, and the disparity between the distal and proximal joints was more pronounced. For more detailed analysis of the results, please refer to our full paper in the conference proceedings. In conclusion, we demonstrated our VR Exergame's feasibility, usability, and clinical acceptance through 2 studies, showing that the Exergame delivered engaging game experiences, elicited measurable improvements in mobility, and maintained physiological safety in a critical care environment. As future work, we plan to explore the integration of lightweight wearable trackers, such as the Vive Ultimate Tracker, to enhance the tracking accuracy of each joint and support more complex or fine-grained mobility challenges. Furthermore, we are working on expanding the gain levels to a more complex and broader range of motion to assess longer-term functional outcomes, recovery trajectories, and integration with standard physical therapy workflows, particularly for ICU patients with extended length of stays. Finally, this work was supported in part by NSF and Duke University School of Nursing, and we thank all nurses and patients who participated in our study. Thank you.